Thank you so much, Amy. That's everything exactly correct and up to the point. The Senior Medicare Patrol, it's a statewide program. My name is Jesus Enriquez, and I do represent the statewide program for Medicare Fraud Protection. So SMP stands for Senior Medicare Patrol, as we have on the screen, Illinois SMP, and it reads empowering seniors to prevent healthcare fraud. And we do have a website, Illinois SMP, one word, .org. So let's get started with the presentation. So the SMP, like I said before, is a statewide program, meaning it's everywhere in Illinois, and it's managed by H Options. And as a refresher, H Options is a service area agency for seniors with social services and referrals to your local area senior centers where they can provide more localized resources. And Illinois Senior Medicare Patrol happened to be one of the internal programs that we have. And the SMP stands, the initial stands to empower Medicare beneficiaries, their families, their caregivers, anybody really that is with a Medicare beneficiary about how to protect, detect, and report fraud. And we will describe these steps in a minute. The Administration for Community Living, ACL, and the federal government agency provides funding for SMP program in all 50 states, including Washington, D.C., Puerto Rico, Guam, and Virgin Islands. So everybody you travel within the 50 with the states in the United States and those territories, just so you know, you'll have a fraud unit that will prevent Medicare fraud and report that as well. The ACL in the SMP program works in partnership with the U.S. Department of Health and Human Services and also the U.S. Department of Justice to fight Medicare fraud. So let's say somebody has indeed a case of fraud. We refer that to a national database where those organizations can oversee the claim, and then they can do any legal action or any enforcement action. So this is who we are. So next, what topics are we going to cover today? Defining the differences between healthcare fraud versus an error. So because there are differences on those. Discuss the importance of reporting fraud and how this fraud can affect your community. We're reviewing some examples of potential healthcare fraud and how you can spot healthcare fraud in your community. And then we are reviewing some COVID-19 scam trends, because COVID-19 is here, the pandemic is here, and so as their scams. And we have times for Q&As. This presentation again is recorded. Once we finish the modules for the presentation, before times for questions, we'll stop the recording. And if you are in the audience right now, later you can make those questions. So defining healthcare fraud. Potential healthcare fraud is billed for a service you did not receive. So you go to the store and they charge you $6 more. You look at the receipt and you realize you got charged $6 extra. Maybe they scan something twice, or maybe they scan for something different, and you go and get a refund for that. So this is very similar. And also similar bill for something different that you have received, for example, or bill for something that was not medically necessary for you, or billing for the same thing twice. So anything that you don't even need it, you don't really didn't need that, it could be an example Medicare fraud. Now, the billing errors, in another hand, are a human mistake. So it's something that happens accidentally, like entering the wrong name or information. For example, if it's an error or a human error and not fraud, usually working with the provider will rectify the problem. So usually the provider, your main doctor, might bill something incorrectly. You call the doctor in the clinic, they will take the money back to Medicare and they will fix the problem. They will eliminate the code or put the code correctly. Again, that's a human mistake. So check your knowledge question 1. If you want to type it in the chat box, go ahead. But this is the question. I'll also give you the answer as well. The definition of, and then blank, is when somebody intentionally deceives or makes misrepresentations to obtain money or property from Medicare. So do you think this is A for fraud or B for error? And again, feel free to type it in the chat box as well. If you are watching this Facebook Live stream later, then you can figure out yourself. So I'm just gonna flip this page right here and you'll see the answer. The answer is fraud. The answer is fraud because an error is considered without intentions or unintentional and can be easily fixed with the help of Medicare and the provider. Fraud is an intentional act of billing somebody for services not provided, services not necessary, or billing many times for one thing. So that's fraud. Now, question 2, billing errors will always indicate a healthcare provider or supplier intent to commit fraud. If it's true or it's false. So billing errors will always indicate a healthcare provider or supplier intent to commit fraud. Is it true or false? Let's flip this page. The answer for that is false, because it's possible that billing errors happen through Medicare without the intention of committing fraud. Medicare will process many claims every year and every day, making Medicare beneficiaries susceptible to mistakes. So it just happens, and it's a part of the process, and it could be easily fixable. So yeah, the answer for that is false. Now, how much money is lost? So this is very important to understand how much money is lost, because once you know the answer to this, you will think for a minute and realize that something needs to be done. Many surveillance or policing or community policing, anything has to be done to prevent this amount of money from being bigger or from happening to begin with. So the question is here, how much money do you think is lost every year for Medicare fraud and abuse? So it's 5 to 10 million or 25 to 125 million, 10 to 20 billion, or the D is 60 to 100 billion. So this information that I'm gonna give you is according to ARP Bulletin Board, titled Medicare Under Assault from Fraudsters from 2018. So the answer is very staggering. I will show you this answer. $60 billion as of the end of 2017, during the whole year, for example, $60 billion was lost through Medicare fraud, beating out any other expenses from any other federal agency. That is a lot of money. $60 billion, you can do a lot with for other agencies, or even to strengthen the Medicare program. And that could be another reason why Medicare Part B went up, and how the prices keep going up in Medicare every month. Could be also because they have to recoup this money somewhere else. And these $60 billion, 95% of this money is gone. There might be some recoveries amount every year, but reality or honesty, a lot of that money it's gone. There's no way to recover it, unfortunately. So here is a video that is going to show you some example of what it is, the durable medical equipment fraud. And this is an interview by CBS 2 News, where we have with S&P unit, there's a Medicare beneficiary that came forward, and because of that was able to restore his benefits.
If you're in pain, a free back or neck brace sounds like a good deal.
But it's really part of a multi-million-dollar scam by many different companies that are ripping taxpayers off. Pam Zeckman investigates this new scam that we're all paying for.
I realized, oops, I shouldn't have done that.
Donald gave out his Social Security number over the phone to someone he thought was from Medicare. Then he received calls about ordering braces, calls like this.
You may qualify for a knee or back brace at little to no cost to you.
Do you need a brace?
No, I'm fine. I don't need a brace.
But Medicare still paid more than $3,000 to a medical supply company for 5 braces that he didn't need and never received.
No, I'm sorry. I did not order any braces.
Over the course of 4 weeks, Mabel Fowler received 10 braces from 5 companies: back braces, arm braces, leg braces, braces for every limb. Did you order any of these things?
No.
But Medicare has already paid more than $4,000 for the braces. All this begs the question, why didn't Medicare suspect something was wrong before approving payment for all these braces for just one person in 4 weeks?
Currently, the medical supplies phone scams are the biggest one in the state and across the country.
I feel violated, is what I feel.
Medicare is now investigating. CBS 2 investigator Pam Zeckman will have more on how this scheme works and how big it is tonight on CBS 2 News.
And this is just one example. Durable medical equipment is one of the most common scams in the United States. It happens everywhere. And of course, it has happened in Illinois. So the providers try to sell something that you don't need. So the knee braces and back braces are perfect examples of that. So this takes us to our mission to protect, detect, and report. 3 steps. Protect yourself from fraud, educating yourself about Medicare fraud and the latest trends. Protect your Medicare card and Social Security number and treat them as they are confidential and nobody should have access to them unless you authorize that. Use a calendar or personal healthcare journal to record your doctor's visits and services and report any suspicious activity to the Illinois SMP. That includes suspicious phone calls that you receive asking for your Medicare number. This is what you shouldn't do. Do not give your Medicare card, Medicare number, Social Security card, Social Security number to anyone except your doctor or people you know should have it. Do not accept medical supplies or services from somebody coming to your house and trying to sell you something, or somebody calling you over the phone. Do not allow anyone except your doctor to recommend services. Now, to detect fraud, it's making sure you prevent this from happening. Read your Medicare summary notice or explanation of benefits from your insurance company in case you get private insurance through Medicare. Watch for services or equipment you didn't receive. Services or equipment not ordered by your own doctor. Billing for the same thing twice, and other billing errors. Medicare summary notices, remember, will be sent to you every 90 days or every 3 months. And if you didn't get it, or you're curious about 1 3-month period, 90 days period specifically, you can call 1-800-Medicare and get one mailed to you. Even if you have private insurance, you can still request it. Or if you have private insurance, remember, those are sent to you every 30 days. So it's a little faster. And you can view your eMSN, electronic MSN paperless option monthly by going in through mymedicare.gov. It's completely free to sign up. And you have an identity verification. And once you pass that, you will be able to access it online, so you don't have to wait on the phone to get that information. Why is it important to report fraud? Like as you saw in the video, imagine there's millions of people scammed like that every year. That equals to billions of taxpayer dollars as well as your own, and are going to waste every year as a result of Medicare and Medicaid fraud. When equipment is sent fraudulently and not ordered by your main doctor, it might not be good for your health. Your Medicare benefits, specifically for that matter, will be used up. And when you need them for a legitimate reason, it's possible that Medicare issues a denial because Medicare has a way of seeing that it was already provided to you. If you think there might be a billing error or a service error by your provider, call the billing hotline of that provider and try to resolve the problem. If the provider will not want to explain it or correct it for you, and you can suspect fraud from that, then you can call the Illinois SMP. We have a general number at each options 1-800-699-9043. Again, 1-800-699-9043. And with that, we have also a reminder about your doctor. Work with your doctor. If you need equipment and services, you and your doctor will make the decision. Only give your Medicare number to your doctor, not anybody else. And your Medicare enrolled doctor will write an order for services when it's medically necessary. And remember, there's a lot of exams, there's a lot of evaluations there, and also Medicare has to look at the paperwork before even approving anything. A scammer, they already are illegally getting things approved through Medicare by proctoring papers, but also forging documents to make them seem legit. So that's why it's easier for them to get things approved through Medicare. Now we have the COVID-19 scam trends, and they are happening. They are targeting older adults and those with serious long-term health conditions. Fraudsters are attempting to bill Medicare for sham testing or treatments related to COVID-19. And obviously, as we know, last year and even until this year, last year actually, they tried to also create fake vaccines and then try to bill Medicare for it. Also, scams that are happening currently are scams related to cardiogenetic testing fraud. We had an uptick of those cases involving somebody calling you and telling you that you need a genetic testing and that your cardiologist ordered it. The problem with that is that if somebody really has a cardiologist and they are having problems with the heart, they can easily fall into the scam. If you don't have a cardiologist, obviously that call could be suspicious, but imagine yourself for a second if you happen to have a legit cardiologist. So we have to be very mindful with that. The genetic testing, it's only ordered through special circumstances, and a lot of times it's not covered through Medicare because they need a layer of approval. It needs a lot of things, and a lot of cases it has to be paid out of pocket. So again, continuing with this topic, the scams are happening through unsolicited phone calls. They are happening through emails, home visitations, and text messaging. There are also social media ads and internet offerings. Now, more tips to prevent scams. Do not give your Medicare number to anybody other than your doctor or healthcare provider. Protect your Medicare number and your Medicare card or number as well. Never provide your Medicare number to anybody calling you through unsolicited calls, texts, or emails. And be cautious of anybody coming to your door and offering free supplies related to preventing or curing COVID-19. You know that's not the way it's supposed to be. Nobody's going to your door or even trying to offering you vaccines or anything to cure you about COVID. So you know that's not happening. So if you have a legitimate reason with COVID or you want a vaccine, it's always to contact your doctor first in your clinic. Even the same goes too with the COVID-19 testing too. The COVID-19 testing sites have to be approved by the state of Illinois. And also, like the governor mentioned before, go to the testing sites that are only approved by the state. It's a better idea. So here are 3 things that we have to remember. Don't click on links from sources that you don't know, because they can put your computer or device at risk. And then be cautious when purchasing medical supplies from unverified sources that you don't know, including online ads and email and phone solicitations. Ignore online offers for vaccines. So in the past, and even now, there might be some of those. There were some surveys of satisfaction to see what do you think about Pfizer or Moderna. Nobody sends that. Or there might be even boosters right now, like fake advertisements about boosters, asking you for your social security or Medicare or insurance information. Those are scams. So if you see that online or you see any cures or studies for COVID-19, that they might look like legitimate, but they really aren't because they're in social media. They could be a scam, especially if they're asking you for your social or asking you for your insurance information online. So be very mindful on those. Now, with Medicare and COVID-19, Medicare Part B, as in boy, covers COVID-19 testing ordered by your doctor since the beginning of the pandemic, February 4, 2020. Medicare covers all medically necessary hospitalizations as a result of COVID. Medicare has telehealth services coverage to enable beneficiaries to access their healthcare. At this point, a lot of people was able to access that. That still remains in place. Medicare covers the COVID-19 vaccine at no cost to you. If somebody's trying to charge you, they're obviously not following the rules, and they should be covering this through Medicare. For Medicare coverage questions, and also for the extra enrollment period, if you want to change plans from Medicare Advantage, you can do so only one time from now until March 31st. So from January 1st to March 31st, that's the extended open enrollment period, only to change Medicare Advantage once. So you have those questions, or you have more questions about your Medicare plan, you can contact Senior Health Insurance Program at 1-800-252-8966, or you can go online to medicare.gov. Now, make sure you receive your 2 shots of COVID-19, your initial series of shots of COVID-19, and make sure you also get boosted, because the booster can and the vaccinations can prevent you to be hospitalized. It might not prevent you from getting COVID, but at least hospitalizations or severe cases of COVID could be prevented. The IDPH, Illinois Department of Health, is handling distribution of COVID-19 vaccines, and very importantly, lately, COVID-19 testing. So you want to go through sites vetted by the state of Illinois. You can visit coronavirus.illinois.gov. You can also visit cdc.gov for the recent guidelines and lines and instructions about the pandemic and initial recommendations from them. And also, especially right now with vaccines too, you want to watch the groups that are eligible for boosters at this time. Again, it's people over 12 years old at the time, but there's a lot of specific information about the kinds of vaccines they can get. And then visit vaccines.gov if you want to search and find a vaccine in the United States. You can also text GetVax at 438829 in English to receive 3 vaccines in your phone within seconds near you. And then if you want to also call the National COVID Vaccine Assistance Hotline, in case you don't have internet, or you know somebody that doesn't have internet or doesn't feel comfortable going online, 1-800-232-0233. So that's a it's completely free number to call. And then we have what we call the Illinois S&P fraud alerts. The S&P program has fraud alerts every other Monday. These alerts contain fraud-related news articles or information about current scams in Illinois and other parts of the United States, and useful healthcare and fraud-related sources. And you can share this with your colleagues, professionals, community members, friends, neighbors in your area. So you can go through hoptions.org, to our website, and look at S&P program in the menu, and you can click in the main page of S&P. You can click on fraud alerts. It will take you to a link. You only need to put your email, and then you'll be registered for those alerts. Volunteers can present too. So we have about close to 30 to 40 volunteers statewide. So those volunteers can present and provide information outreach, and they can also help to expand the program. They can also distribute information in different centers and create connections. So in every agency, we have 13 state agencies through the state of Illinois in different areas. So we partner with all of them. So that's a successful partnership that we have for several years already. And each of them have in average 2 volunteers. Some of them have 5 or 6 volunteers. So that's a key, that we have great partnerships, or help us spread the message. So with volunteer, if you're interested with Illinois SMP, email us at volunteer@HOptions, or you can call the general number 1-800-699-9043. And if you really don't have time to volunteer, you can also spread the word about your neighbors about SMP message, which is to protect, detect, and report Medicare fraud. Now, this is one of the chapters that we have. We have different topics. So we have 4 different topics, and the whole series for Blue Island Library, we will be having 2 of those. So in other sessions that we have online through Zoom during this period, I have also available how to read your Medicare summary notice, which is a demonstration on the screen of the things that you need to look for in the search for fraud and errors. Then we also have another presentation that we're going to see in Blue Island at the end of the month. It's the types of scams. So we will go more in depth about the home health fraud, durable medical equipment fraud, genetic testing scams, and a little bit of more on COVID warnings about fraud. So it's a little more in detail. And then finally, the last chapter available through other workshops. It's tips on how to prevent Medicare fraud. And then you can contact us, and you can contact the library as well. If you want to obtain these PowerPoints so you have it as a guidance, feel free to contact Amy or somebody in the public library. I'll be happy to provide this to a library for future references. And lastly, we have a list of resources. A lot of people like this table because it has a lot of phone numbers that could be useful in case something happens to you from Medicare fraud or questions about Medicare fraud, or if you want to create a presentation out in the community or online. We have our phone number highlighted in blue. We have the SSA, Social Security Administration there. We have the Centers for Medicare and Medicaid phone number. Better Business Bureau, in case you want to know about a reputation of a business to see if they have accreditation for high quality and customer service. If you are a victim of identity theft, too, we have that number. And the Federal Trade Commission, in case you want to submit a complaint about a business. And the Elder Care Locator, wherever in the US you are, it can give you information about social services in that area that you are in. And the SHIP, Senior Health Insurance Program, Medicare Counselor for free. They receive funding from the government. They give free and fair information about every plan. They don't coerce you to get any plan. On the contrary, they steer you in the right direction, and you are the one who choose what to do. So 1-800-252-8966. And with that, Amy, I just want to thank you for the time that you are offering to us to the program. And yeah, I'm really happy to be here again. Thank you.